Good afternoon, everyone. This is Derek Tabor from the National Institute of Minority Health and Health Disparities. Participants will be in listening mode, will not be able to ask questions verbally. Participants may ask questions using the chat feature. Questions will be answered during the question and answer session at the end of the webinar as time permits. These slides and a recording of today's webinar will be available on the NIMHD website. However, I'm not quite sure how soon that will be as we're having some challenges with our website. Here is our agenda for the day. We're going to go over the background and the goals, the application information, peer review of applications, timeline for submission, review, and selection of cooperative agreements, and then selected questions, FAQs, selected FAQs and participant questions. And if you sent me something like within the last hour or two, I did not have a chance to get to those, so you may have to ask them when the time comes. Let's start off with the background. So NIH established this program in 1985 in response to congressional interest in expanding the national capacity for research in the health sciences by providing support to institutions that offer doctorate degrees in the health professions or health-related sciences and have a historical and current commitment to educating underrepresented students, and for institutions that deliver health care and clinical services to medically underserved communities. This program was managed by the National Center for Research Resources until 2012. And I hear some noise in the background, so if you could mute yourself, that would be greatly appreciated. Some more background. The NIMH RCMI program recognizes the important role institutions with a historical commitment to training diverse individuals and serving disadvantaged communities have played in advancing health-related scientific research. These institutions are uniquely positioned to engage minority populations in research and in the translation of research advances into culturally competent, measurable, and sustained improvements in health outcomes. But they often lack the research infrastructure and capacity to conduct cutting-edge health-related research or basic research. Our mission is to conduct and support research, training, health information dissemination, and other programs with respect to minority health and health disparities populations. This funding opportunity seeks to facilitate the development of research capacity in diverse institutions and research education of students/faculty to pursue basic biomedical, behavioral, and/or clinical research, particularly on diseases that disproportionately impact racial, ethnic minorities, and other health disparity populations. This RFA, MD 20-006, supports NIMHD's interest in diversity. This RFA provides cooperative agreement support for specialized research centers and institutions that offer doctorate degrees in the health professions or in health-related science and have a historical and current commitment to educating underrepresented students, and for institutions that deliver health care and provide clinical services to medically underserved communities. The primary goals of the center are to enhance institutional research capacity to conduct world-class basic biomedical, behavioral, and/or clinical research, to enable all levels of investigators to become more successful in obtaining competitive extramural support, especially from NIH, and particularly for research on diseases and conditions that disproportionately impact minority and health disparity populations. Foster environments conducive to career development and enhancement for postdoctoral fellows, junior faculty, and other early-stage investigators, and here, early-stage investigators is defined by NIH. The fourth goal is to enhance the tools for, conduct of, and dissemination of research generally, and specifically for advancing minority health and preventing and eliminating health disparities. And lastly, to establish sustainable relationships with community-based organizations that will partner with the RCMI institution. So in this section, we're going to go over some application information, but I wanted to start out with some key information. Oftentimes, people have questions on this information, so that's why I wanted to include it. Only one application is allowed. We look at this from the perspective of a unique DUNS number or an IPF number. So one has to have different numbers for us to receive an application from a otherwise same institution. Types of applications, and I've included here a link to the types of applications that you can find as spelled out in the grants policy. We have 3 that are applicable for this. They can be new, they can be renewal, or they can be resubmissions. This is further explained a little bit more in the OER glossary, and I've provided that hyperlink as well. And only the applications types listed here, namely those 3, new, renewal, and submission, are allowed for this FOA. I've also included a link to some frequently asked questions, as well as to a link to resubmissions. Center eligibility is what I want to talk about now. You must be a domestic institution of higher education. You cannot have received, well, you have to receive an average of less than $50 million per year of NIH support for the past 3 fiscal years. You must also award doctorate degrees in the health professions or in the sciences related to health. Have a historical and current mission to educate students identified as underrepresented in biomedical research, or has a documented track record of recruiting, training, and or educating and graduating underrepresented students, and providing clinical services to medically underserved communities. This is for institutions that deliver healthcare services, and not all of the institutions will do that. Here we list some of the institutions, the higher education institutions that are eligible. So you can be a public, state-controlled institution, you can be a private institution of higher education, Hispanic serving, historically Black colleges and universities, tribally controlled colleges and universities, Alaska Native and Native Hawaiian serving institutions, or Alaskan American Native American Pacific Islander serving institutions. The important part, remember, are those earlier eligibility requirements as well. You have to be able to offer a doctorate degree. Centers, all applications for centers must have an explicit focus on one or more of the following areas: basic research, behavioral and/or clinical research. You don't have to have one in all, but I'll talk about that a little bit more. Behavior and clinical research areas are expected to emphasize minority health and health disparities. Focus can only be demonstrated by one or more research projects in the focus area. This slide shows the center core and components. The application should consist of the following components. You'll note that some are required and one is optional. Overall required, administrative core required, research infrastructure core required, investigator development core is required, community engagement core is required, recruitment core is optional. Research projects, up to 3 can be submitted, but at least 1 is required. I'm next going to go through those different cores and highlight some of the aspects of them, but not all. In the FOA, you'll see more information about each one of these cores. So we're just going to highlight some aspects of the cores and components. So the administrative core is expected to provide administrative and logistical support for all center activities. It also provides career enhancement activities for postdoctoral fellows, early stage, and junior investigators. It also provides an evaluation of each proposed activity core and evaluation of the impact of the center. Here's another slide showing another core. This is the research infrastructure core. And it provides resources to assist investigators with developing design and analysis plans for studies. It includes faculty level expertise in research methodology, specialized laboratory techniques, statistics, bioinformatics, and/or health informatics. These are just examples. They may include other things dependent upon the type of research that is ongoing in the proposed center. It may provide linkages to other NIH-supported programs, such as the CTSA program or the NIMHD Centers of Excellence. And again, these are just examples. Core research resources must be for multiple users across various disciplines. And again, this can extend beyond the disciplines represented in your application, but definitely you want to make sure that you cover those disciplines, represented in your center. Minor alteration and renovation cost allowed up to $500,000 in the first year only to improve research core laboratories or animal facilities. You may see another number in the FOA. There was an error, I think, but this is the correct number, 500, no more than 500K. The Investigator Development Core provides pilot project. It provides the pilot project program. This program allows researchers to generate preliminary data for subsequent submission of grant applications related to minority health and health disparities, or develops new technologies to better position the institution to conduct basic biomedical research. The program may support up to 5 pilot projects per year at $30,000 to $50,000 per project. Minimum direct budget allocation for pilot project program is $150,000 per year annually. This is the minimum. Pilot project investigators should be at the senior postdoc level or assistant professor level and include individuals from backgrounds underrepresented in biomedical research career. The Community Engagement Core facilitates long-term relationships with community-based organizations to address their health-related concerns, to promote participation in research and recruitment and retention of study participants, and to disseminate findings from research projects. And this could also include disseminating findings from pilot projects. Now I want to talk about the research projects. Up to 3 research projects may be proposed in basic biomedical, behavioral, and/or clinical health services research. Having a project in each area is not required. When behavioral and clinical health science services projects must emphasize minority health or health disparities. Projects may vary in scope and budget, but together they must comprise 20 to 30% of direct costs per year. Projects may be led by investigators of any rank, including senior or established scientists. Recall that one core was optional. That's the recruitment core. I'm going to talk about that now. This core supports hiring investigators who have track records of independent research support, who can serve as mentors to early stage investigators. New faculty members may be provided with startup funds of up to $100,000 direct cost per year for up to 2 years. The award budget, we've set aside $10 million we've allocated $10 million for this program and anticipate making 3 awards. Budgets are limited to $3 million or less in direct costs per year. Budget requests should correspond to a number of focus areas: basic, biomedical, behavioral, or clinical. One focus area will allow you to have a direct cost of up to $1.5 million. 2 areas, $2,250,000, and 3 optional. So the 3 focus areas, up to $3 million direct costs is possible. Now recall, you don't have to go up to $3 million. It can be less than $3 million, but it can't be more so. Optional minor repair, alterations, and renovation costs of up to $500,000 in first year do not count towards these direct cost limits. At this time, I'm going to turn it over to my colleague, and he will take you through the peer review of applications.
Hello, here speaker Dr. Xin Nan from Scientific Review Branch. Now I want to switch the gear to part 3, peer review of applications. U54 program peer review begins with receiving application, which will be assessed by for completeness by the Center for Scientific Review, short for CSR. Then your application will be referred to us by CSR. Our program staff will assess the applications for responsiveness based on eligibility criteria in the RFA. And the applications are deemed to be responsive or passed on to scientific review officer, who will assemble a panel of experts from the extramural community to peer review the application. This slide shows you preparation for peer review. What preparation for peer review will be undertaken by SRO. So you will understand how your application will be handled as you are prepare your application and get ready for peer review. First, SRO will look at the RFA or specific characteristic that includes overall program goals. And then the mechanisms specific characteristic relate to this RCMI, RFA. The review criteria that specified in RFA section 5. Are there any specific review queries to this RFA? And also to the additional review criteria and additional review consideration for review of overall center and research project. SRO will use those review criteria in section 5 to guide the reviewer for the upcoming review meeting. SRO also to check whether the applications are complete as required by RFA and have the appropriate section to be able to be reviewed. To check which personnel are involved in each application and their institution affiliation in order to generate the key person needs for attention to conflict of interest. To read the specific aims stated in each application in order to identify the expertise needed to recruit reviewers and make assignments. This slide shows you how to select reviewers. The application will be reviewed by special emphasis panel with ad hoc reviewers. To select reviewers, the SRO will look for the balance for scientific expertise as defined in RFA and in the collective content of the application. There is also to attention to conflict of interest for the first representation of opinion with respect of gender, demographics, geography. This slide shows you review process. During pre-meeting, reviewer will be asked to provide independent opinion by submit the written critique and the preliminary scores for the individual components and for the application as a whole. During review meeting, reviewer will present the review opinion and the panel member will discuss the application to determine the overall impact score for the application. SRO, in listen to the discussion, will collect meeting notes. In the following, after review meeting, the SRO will exempt resume from the meeting notes and the reviewer's written critique, then finalize the summary statements. This slide shows you peer review criterion. For the whole application, reviewers evaluate an application potential to succeed. The panel member will take consideration of scientific merit of the overall center, evaluation of all cores as a whole, and research projects to determine the overall impact score. Please keep in mind the overall impact score is not always an average of the multi-component scores. For administrative core, research infrastructure core, investigator development core, community engagement core, and optional recruitment course, reviewer will provide only one overall impact score to reflect their assessment of likelihood for the course to exert a sustained, powerful influence on research fields. For overall center and research project components, the review criteria including overall impact. Again, overall impact reflects the likelihood for the center or project to exert a sustained, powerful influence on the research field. The 5 scored review criterion: significance, investigators, innovation, approach, and environment. And finally, the additional review criterion and the additional review consideration that are detailed in the following 2 slides. Additional review criteria which will contribute to overall impact score. If your application is designated clinical trial, you need to start timeline in your application. If your application is involved in human subject study, you need to address the protection for human subject and the recruitment of women, minorities, and individuals across lifespan in your study, or declare the delayed onset. If your application is involved in vertebrate animal study in basic biomedical research, you need to address 4 points. And finally, the biohazards. This slide shows you additional review consideration, which will not contribute to overall impact score, including select agent, research, resource share plan, authentication of key biological and/or chemical resource, which is one of 4 key elements for rigor and reproducibility. And finally, the budget and period support. Like Dr. Tabor stated, the budget limit to 3 million per year up to 5 years. U54 RCMI program peer review meeting. During review meeting, there will be streamlined non-discussed application that will be determined by the panel member. Generally, application that will undergo a selection process in which only those applications deemed to have the highest scientific and technical merit Generally, the top half of applications will be discussed and assign an overall impact score. As I mentioned, that the final impact score are based on average score of all voting reviewers times 10 to get the scores range from 10 exceptional to 90 poor. A summary statement for all application would be available approximately 30 days after the review meeting. Please don't contact members of a review panel. A breach of NIH privacy, confidentiality, and integrity rules could cause your application to be withdrawn. Here are resources available to you. The Center for Scientific Review, CSR, has produced videos with an inside look at peer review and with tips for prepare application. ERA comes offer tutorials and videos. Please use those resources and upload your electronic application. I urge you to apply early, so if there are issues, that can be resolved. If you encounter problem with electronic submission process, you should always contact ERA Server Desk. It is important to do so and to document the problem. If the problem related to NIH, we can be helpful for you. If the problem is an issue that relates to your institution computer system, then you need to resolve it prior to the receive deadline is on April 14, 2020. In doubt, if you are ever in doubt as you prepare your application, please consider phoning NIH. There is a contact information for peer review, grant program, and grant management list on the last slide of this application and in the end of RFA. That's part 4. Time for submission, review, and selection of cooperative agreement. Here are important timeline. Letter of intent is due on March 15. Application is due on April 14. Peer review meeting will be held in June. Council meeting in August. Anticipate early start date will be on September 2020. Now I pass back to Derek.
Thank you, Shinli. I wanted to cover the selection process because in Shinli's timeline, we went from council review to earliest date. But what's involved in that is program selection. So in the RFA section 5.2, you'll see where it says review and selection processes, and I've extracted just 2 parts from that. The first is appeals. Appeals of initial prior peer review will not be accepted for applications submitted in response to this FOA. The other important note comes in the next paragraph. Applications will compete for available funds with all recommended applications submitted in response to this FOA. Following initial peer review, recommended applications will receive a second level of review by the National Advisory Council on Minority Health and Health Disparities. The following will be considered in making our funding decisions. Scientific and technical merit of the proposed project is determined by scientific peer review, the availability of funds, the relevance of the proposed project program priorities. All right, so I was going through these bullets. So the last one is with geographic distribution of awardees. And that was these are important things that you need to know regarding our funding decisions. Part 5, selected FAQs and participant questions. Now, some of you have already sent questions in. If you sent them to me in my Outlook, I won't be able to retrieve them for here. So you may want to resubmit them. We're first going to go through some selected questions that I've received. And then after that, we'll have a open time when we'll go through the questions that are submitted by the webinar chat, and we will continue until our time runs out or we have exhausted all questions. Can NIMHD confirm that my institution is eligible to apply? This is a common question, and the answer to that is no. NIMHD staff can answer questions you have about the eligibility requirements, about the RFA clarity of it, but it's the responsibility of the institution to determine if all eligibility criteria have been met. My institution as a whole exceeds the NIH funding limit, but my school is below the funding threshold. Can my school submit an application? The answer is it depends on how your institution is organized. If your school or department has its own DUNS or NIH IPF number, it can serve as an applicant institution, providing all other eligibility criteria are met. Does a residency program in a hospital count towards the health-related doctoral degree requirement? No. Only institutions of higher education are eligible per congressional language that establish the RCMI program. My institution offers health-related doctoral degrees, but not in my department. Can I be the PI on the application? This decision is left up to the applicant institution. If an institution submits more than one application, will only one application be selected for funding if they all score well in peer review? Only one application for institution will be reviewed. If multiple applications are submitted, NIMHD will request that the institution select which application will move forward. Now, just to clarify, if multiple applications are submitted and the applicant institution does not have a separate, let's say it's a separate department, does not have a separate DUNS number, then we will contact the institution and let them tell us which application should move forward. And this will happen before the applications are reviewed. Can the focus areas shift over the course of the grant period? Yes. It is not required that the center maintain the same foci or budgets attached to them over the 5-year period. However, the funding level for the number of focus areas corresponds to the yearly budget. For example, if $3 million in indirect costs were requested in any budget year, research projects in all 3 focus areas would need to be active in that year. Question, do we have to propose a research project in each of the 3 areas? No, unless you're requesting the full budget amount. Remember, the budget amount is tied to the number of focus areas. Do all research projects and pilot projects in clinical or behavioral research have to focus on racial ethnic minorities? No. Projects can emphasize minority health or health disparities. Health disparity populations include racial ethnic minorities, socially economically disadvantaged populations, underserved rural populations, and sexual and gender minorities. Should advisory committee members be named in the application? Please do not list the members on your advisory committee. The plan, roles, and expertise of the advisory committee should be described in the application, but it is not necessary to provide names of specific members. Question, does each section of the research infrastructure core, biostatistics, laboratory technologies, etc., have a 6-page limit? The answer is no. The page limit for the entire research infrastructure core is 6 pages. Are there different page limits depending on the scope of the research projects? R01 versus R21? No. The page limit for each research project is up to 12 pages. Remember, this is a page limit, not the number of pages required. Projects that are smaller in scope may not require as many pages as larger projects. Question, should individual pilot projects be described in the application? No. The application should describe the pilot project program. That is how you will solicit pilot projects, how you will select them, how you will support them, and how you will monitor them, not individual projects. The projects will be selected after the center application is awarded. Question, can salary support for postdocs be included in pilot projects, other cores? Salary support for postdocs is an allowable cost within any center component for those engaged as personnel on research projects or other center activities. Stipends and fellowships, which are associated with training programs, are not allowed in this RFA. Is the letter of intent mandatory? Is the letter of intent binding? No and no. The purpose of the letter of intent is to give NIMHD, particularly the review office, a sense of how many applications to expect and what kinds of expertise might be needed to review them. It is possible to submit a letter of intent and then not submit an application and vice versa. So for slide 46, we had a question on the project narrative. And this was the question, and this is the answer. So you'll see when you go to each of the components, other than the overall, they'll have in there for project narrative, do not complete. But let's explore this a little bit more. So what I have here is the same question. And I have there under the question, the first line, for answer C, this link. That's the hyperlink to the NIH FAQs. Now, when you read that, the answer is, how do I include, so they have another question, but it kind of answers ours. What do I include in the attachments in the overall component versus the attachment for the other components? The general rule is that the overall component should explain the application as a whole and how all the components fit together. Information provided for other components should be specific to theirs. Many funding opportunity announcements provide very specific guidance in what to include in the attachments of various components. This guidance should always be followed. If an FOA does not provide specific guidance, then the instruction in the application guide should be followed. The project summary abstract / attachment on the R&R and other project information form is required for the overall and all components. The project narrative, this is the answer to the question, project narrative attachment on the R&R, other product information form, is required for the overall component, but FOAs can indicate it is not required for other components, as is the case for us. Some submission methods may show a next to the field or whatever, but the important part for this is that the project narrative is only to be included in the overall section. Letters of support. Do all letters of support, including those for individual project cores, go in the overall part? Here, the answer can be found right in the RFA, especially if you do a word search, letters of support. And so here I've extracted the answer. Applicants must provide letters from the appropriate high-ranking institutional officials, indicate the commitment. And what it says is as we go down to 1, 2, 3, 4, 5, the fifth little two-line paragraph, all other letters of support for all applications of component should be included. also within this section in the overall component. The letters of support attachment should begin with a table of letter authors, their institutions, the type of each letter, institutional commitment or resources, collaboration or role in the project, potential or current user of a resource or service proposed in the application. Now we're going to take some questions from the chat. And I think the first question had to do with the number of applications that we will ultimately end up funding. And the target is 3. And it doesn't matter if those are new renewals or resubmissions. Total of 3, they could be all new, they could be all renewals, they could be all resubmissions, or a combination thereof.
A second question is the scope. Should the research project submitted with the application be R1 in scope, or can they be more along the lines of an R21?
So the question has to do with scope. Can the scope be more along, this is of the research projects, right?
For the research project.
For the research projects. So this was a question, but it does not, it can be whatever you like it to be. It can be, you may have projects that are R01 in scope, or that are all R21 in scope, or mixture thereof. That is up to you and not us, but it's no requirement that it has to be of a particular scope.
Hi, this is Priscilla Grant. There was a slide that referenced salary support for investigators being developed, and that really could have said compensation for services rendered. It didn't necessarily have to be salary.
Thank you. Are there any other questions? Investigator development, can this include pipelines to develop minority graduate students or even undergraduates? The focus of the investigative development program is on postdoctoral investigators, early stage investigators, and junior faculty. So graduate students, we're not interested in supporting graduate students or undergraduates within the investigator development core or the pilot project program. So here's the timeline, and also there was a question that's kind of related, and that's whether or not the RFA will be offered again. That's unknowable at this time, because if I said yes, the next question is when. I don't know when, so I don't know when it's going to be offered again. But keep your eye on the NIH guide for contracts, grants and contracts. This year we put in a notice that we would be developing a FOA, and I suspect that we'll do that next time as well. So here's another question. Could we do 1 or 2 research efforts in year 1 and 2, for example, but then seek 3 efforts in year 3 to 5? So this is for the research projects. I guess the question is, can we have research projects that would be for a duration of 2 years and then submit new ones? I think the best way to answer that is we can only support projects that have been reviewed. So if it hasn't been reviewed by NIMHD, then you wouldn't be able to do this. Pilot projects, they go through a different type of, yes, just a minute.
They specify in the peer-reviewed application that there's a 3rd starting in year 3.
Well, the question is, or for clarification, what if they specified that there would be a 3rd project starting in year 3? It needs to be included in the grant. That's all, in the application. That's all I'm saying. So if you want to start a 3rd project in year 3 or year 4, then it needs to be reviewed when you submit your application, right? pilot projects they have as part of the pilot project program, they will be reviewed according to the process that you lay out in your application, which then will be reviewed by NIH by the scientific review, peer review. So they will peer review the actual process by which you will select pilot programs. Okay. Well, it looks like we've answered all the questions. And in case we didn't and you have additional questions, then you can send those questions dealing with program to me, and they send programs dealing with review to you. So you can submit any review questions to either Dr. Nan or Dr. Lodge Sharp. And program questions come to me. All right, so thank you for your attendance. Again, if you have additional questions, send them to us, and we will try to get the to get this recorded webinar on our website as soon as possible. So please keep an eye out for it. And will we share the PowerPoint? That will be uploaded to the NIMHD website. Can I share it before then? Maybe. So if so, I need to be able to send it out to everyone. And so since I can't send it out to everyone, probably won't be able to send it out to anyone. So we'll just have to wait until it comes up. But if you have any questions, don't hesitate to contact us. Thank you all very much for your interest in the RCMI program, and we look forward to your further questions and or your application and your letter of intent. Thank you. Bye now.